The new air ambulance service in the valley is now carrying blood on their emergency calls. Emergency crews say it's essential at trauma scenes to save lives. Channel 5's Christian Von Preissing reports.
When the minutes count, there's no time for traffic lights, winding roads, stalled traffic. This is pretty much the fastest way to get medical care. With a crew that does their best to prepare for the unknown.
We don't expect to use blood every day.
AirMed, based in McAllen, responding to severe accidents, trauma cases.
We never know what we're going to get or if we're going to get a second back-to-back flight.
The EMS service now bringing blood on board their flights to scenarios where it can mean a difference.
But probably about 10% of the patients that we fly would be able to benefit from carrying blood on board.
This is Luis Corbet. He says it took 6 months to coordinate what's needed to bring blood on these flights. They need to keep it in a refrigerator at their hangar, kept between 50 and 32 degrees Fahrenheit. When a call comes in, they load it onto a cooler along with several freezer packs before carrying it to the flight for the duration of the call. The blood type, O positive.
We can transfuse that into any age patient, any adult, or any pediatric.
There's several kinds of blood. The universal type, O negative, is in short supply, so they bring O positive, which can be administered to people with most blood types. Corbet says the ones who aren't compatible can be treated with a drug called Rogam to suppress reactions. Upon arriving to the hospital,
it can make a significant difference.
Dr. Robert Martinez, chief physician executive at DHR, says it's seen often. Bleeding patients can't make it to the hospital in time with enough blood. A transfusion.
That can be, save you an hour, which is all the time in the world if you're, north of the checkpoint or somewhere in that area where it's going to take you, even by helicopter, time to get here. You're talking significant advantage when you consider that brain tissue starts to die after about 3 to 4 minutes.
The brain dies when the blood can't bring in enough oxygen. Blood is perishable and always in need. It can't be kept forever.
After 30 days, basically it gets thrown away.
That makes this expensive. All over, first responders are asking for more blood supply.
If you have an opportunity to donate blood, maybe you can be that 1% to change that shortage of blood that we have.
Blood that can make all the difference. Christian Von Preissing, Channel 5 News this morning.
AirMed and DHR says they're always experiencing a shortage of blood and encourage everyone to donate.